okay, parents, your kids are going to turn out just fine.
This episode of the podcast is brought to you by FOCO. That's FOCO, F-O-C-O. If you are a parent of a child or teen with ADHD, you know how challenging it can be to keep them focused and engaged. FOCO is the all-natural solution for ADHD, whether it's for school, homework, or just everyday activities. FOCO helps your child or teen stay calm and attentive. Before trying prescription drugs like Adderall that can come with harsh side effects, I recommend you try FOCO. Visit ThinkFOCO, that's ThinkFoco, thinkfoco.com for more information. This is the Your Kids Will Be Fine podcast. I am Dr. Michael Milobsky, board certified pediatrician, father of 7, grandfather of 3. And on our podcast today, we have an incredibly special guest, Melanie Potok, MACCSLP, is a pediatric feeding therapist, international speaker, certified speech language pathologist with over 2 decades of experience helping children and families establish healthy relationships with food. On Instagram, you'll see her as Coach Mel at My Munch Bug, Melanie Potok. She is the author of 6 books, and I recommend many of her books in my office, just as an aside, including the award-winning Raising a Healthy, Happy Eater and Responsive Feeding. She's a sought-after expert in typical and complex feeding development. And Melanie combines evidence-based strategies with real-life parenting insight. And I can say personally, I have learned so much from Melanie's content as a pediatrician. And this is not something that, honestly, we get a lot of education in our medical training. In fact, I had to learn most of this on my own. And Melanie's content and her books have been instrumental in helping me help more families with their eating journey, safely and healthy and safe eating journey. Thank you for joining, Melanie. Really excited to have you on the podcast.
Dr. Mike, it's so good to see you.
So good to see you. We see you. Right?
We live,
no conflict of interest.
Very close to your practice. So yes, so thank you.
Exactly.
But come on, tell everybody who's the cutest baby in your practice.
Hands down, there is not even a close second place at this point. Melanie, most of the people who follow my content saw the series of videos that we put up last week, all about eating and feeding, all about the difficulties and the struggles that parents have around initiating feeding, and the stress around what's normal, when to be worried. And as you know, and the theme of our podcast and the theme of a lot of the content is that parents are, I think, overwhelmed with so much information, and they feel this constant sense of anxiety that they're doing something wrong, and what if they're missing something, and feeling judged and parenting in the public sphere, and not having necessarily close family anymore, and so not getting necessarily the same kind of regular input. So feeding issues, I think, strike a very primal and emotional chord with all parents, starting very early with the anxiety about choking and the anxiety about initiating, and then the anxiety about pickiness. So I want to start I want parents to hear from someone who does this full-time as their career. When you start with initiating solids, it's such an active topic. And I tried to outline the latest sort of recommendations in research, but what are your non-negotiables? When parents, what should parents know more than anything else around the idea of initiating in a healthy way and safe way solid foods with their babies?
Well, I love this question. And you know me, I could talk about this all day, and it's such a pleasure to do this with you. So thank you. I appreciate it.
Sure.
I'm going to try to contain it to just 5 almost non-negotiables when starting solids. This is the way I kind of phrase it when I'm first working with a family in feeding therapy, or just helping a family start solids in general. Here's what I want every parent to know. Yes, I agree 100%. Parents feel so much pressure when it comes to starting solids. And there's so much information out there, and some of it's good and some of it not so great. And social media can be tricky, especially. And I feel like parents are going to social media more and more for some instant answers. But there's really not just one right way to do it, but there are 5 things that I want parents to focus on. And the first one, of course, is safety. And when we talk about safety, It's a big one because, well, I'm going to give you 3 points first, and then I'm going to give you the fourth one, which is the biggest one of all. The first 3 points I'll share with are designed really to help you avoid the fourth one. So now I've got you in suspense. But first, under the guidance, of course, of your wonderful pediatrician, try and wait until your baby is closer to 6 months of age in general. Again, these are general non-negotiables. We're going to have exceptions to certain rules.
And what I would like you to sort of also address, though, that the recommendation is really kind of articulated as, hey, between 4 and 6 months. So I really want to hear from someone who
Yeah.
mechanistically understands this so much better than a pediatrician, why you say that.
Yeah. The reason why we say between 4 and 6 months is because there are certain foods we can introduce a little bit earlier, and we're going to go into those in a moment. There's actually 9 of those foods. And we want to wait closer to 6 months because ideally, breast milk formula, et cetera, is the primary source of nutrition for babies up to that age. But we're looking for very specific signs of readiness that are directly related to safety. And although I'm not going to list all of them today, in general, what we're looking for is that that baby can hold their head upright, that they can sit without support just for several minutes. I don't have to have them sitting all the time, but just for a few minutes, because we can always go in and bolster up that feeding chair a little bit just to provide that extra hip support, a little bit, of padding around the shoulders so that they are really secure and stable. You need to have that stable trunk, that's trunk stability, in order to have all of this fine motor happiness happening in your mouth to work effectively and efficiently. It's very important, that core. So in general, that's why we move toward the 6 month mark when it comes to gross and fine motor skills that are going to help that child manipulate the food and swallow safely. But the other thing you do want to watch for is making sure that baby is already bringing teethers and toys up to their mouth. And that's important for me as a feeding therapist because when parents come to me at 6, 7 months with their baby and say, well, he hasn't really put anything in his mouth, I have to ask myself why. And for us to then introduce something that they're going to lose control of, even if it's a puree, when they haven't even put a teether in their mouth yet, that's not a good combination. So that's important to me as a therapist. And then second, as we were just talking about, is just really making sure that they're truly sitting upright. And third, whether you're starting with purees or whether you're going to do baby-led weaning or a combination of both, more of a hybrid approach, which I think is what most parents prefer nowadays in my experience, make sure that you're following reliable, evidence-based sources of information. I can't tell you how many times I've hopped on Facebook groups that are run by individuals who really have no background in feeding development, but they've read a few books and they think they're experts, and that's not going to keep our babies safe. So all 3 of these safety tips are going to help to reduce the risk of choking. And that's our final safety tip. But you've got to know what to do if your baby does choke. Of course, that's number one. Because it can happen. It can happen even without all the precautions. So even so, make sure you're talking to your pediatrician, you're getting online trainings or trainings in the community, and I even offer a short practical course on my website.
Yeah, and I talked about it on my feed as well, how
Good.
it's the one skill, honestly, every parent just has to have handy as far as just saving your baby's life in general or your toddler,
Yeah.
because it's the one thing that a parent can just rapidly intervene where you can't wait for help. So you just have to be comfortable and knowledgeable in choking.
I agree. And grandparents, neighborhood
Yeah.
babysitters, anybody who's going to be around that baby, even if I have to pay for it myself, I get them the training. It's
Yes.
worth that sense of, it's just that sense of mind that everything's going to be okay.
So can you talk a little bit about sort of oral motor cues that also that infants will show? I've been reading a lot. I learned from you about the tongue thrust reflex and
Yeah.
how that naturally extinguishes is another really helpful sign for parents to know that, hey, my baby's ready to advance or ready to kind of move forward in what we're doing with food.
Well, I love that you brought it up that way. And let's make it really clear for everybody.
Yeah.
The tongue thrust reflex is actually still present at 6 months of age, but as you said, it's naturally beginning to extinguish.
Can you describe it so parents can know what we're talking here, what I'm looking
Yes,
at? And what
yes.
we're talking about?
When, if you've ever seen a kitten nursing or drinking from a bottle, if you've ever had to, take care of a baby kitten or any sort of baby animal, but especially, hopefully you've got your own baby that you can watch, their tongue is actually going back and forth under the nipple for the most part. And that back and forth motion is part of that tongue thrust reflex. So it's a reflex that's there to train baby how to move their tongue. And because baby starts to pay attention to this reflex that takes over their tongue, they learn how to do it on their own. So by 6 months of age, the brain is saying, we don't really need this reflex that much anymore, except to help protect the airway. And so when something begins to fall backward toward the airway, like a piece of food that they can't manage safely, then two reflexes, the gag reflex and this tongue thrust reflex, which is still there but not overbearing, begins to jump into action. And so it's a safety mechanism. But gradually, because you've been offering a lot of safe solids and a lot of teethers and babies getting a lot of practice with things in their mouth, by their first birthday, it's almost gone. Definitely by 14 months.
Okay. Can you comment? So many of the families in our practice, just because of what I used to do before I opened this practice, I have a high concentration of NICU grads and premature babies who are challenged with that. Can you talk about how prematurity and corrected age impacts the timeline and how this looks for a lot of families whose infants were maybe 32 weeks, 33 weeks, 35 weeks gestation as opposed to the average full-term infant?
Coincidentally, I also worked in the NICU for 7 years. So that's how I got my start as a pediatric feeding therapist. And so let me know your thoughts on this as well. But each child's unique and each child's nervous system is unique. So sometimes we'll see babies who have been in the NICU, maybe born at 30 weeks, who surprisingly are right on track. And other times we need to adjust according to that extra time that they had to spend growing outside of mommy's belly. And so we may decide to postpone starting solids just slightly, but we're looking at those readiness cues and other cues that therapists like myself pay attention to. But we may also decide to adapt the spoon, adapt the feeding method, adapt the high chair, maybe put that baby on a very tiny bit of a recline, not much, maybe put them in a tumble form chair, various therapeutic modalities that we'll use so they can start solids. And that's especially important because we want to start introducing allergens as soon as possible.
Excellent. That's a great segue. I want to talk about now food choices. And I think this is where I think a lot of families become perhaps overwhelmed by what they see on the shelves and what's marketed to them and what is actually, beneficial and healthy. And not just that, starts to fill your baby's actual nutritional needs as they get past 6 months. And so just so you know where I have tended to stand on this, both because of my own lived experience as a parent and what I see in the clinic, is I tend to push people away from processed baby cereals. I just tend to think they're mostly over-processed carbohydrates and starches without a lot of benefit. And I push people towards single ingredient fresh food that's easy to make in their house without necessarily feeling they have to buy. Not there's anything, look, I'm not a fear monger. Is there anything really wrong with, a single ingredient pureed jarred baby food when you're out in the world? No, but seemingly whenever they test the ingredients, there's stuff in it people don't want. And also it's expense and it's not necessarily healthier and it's not necessarily all that difficult to give your baby, healthy foods just from what you already make with a lot of effort. I tend to tell people, I buy a baby bullet or something similar. Ours went through 4 or 5 children. Now my grandchildren use it. It was the best investment. And we pushed very hard, very early on into allergens. So peanut, egg, and fish, although we're not big fish eaters, as well as meats, and presenting those though as well cooked and pure and softened into a mush because of the vitamin, iron, and nutrient content that seems potent and supports what the kind of organ and brain and neurocognitive development nutritionally that kids need after 6 months. So I'd love to hear your views on those kinds of choices that parents can make up front when they're initiating foods.
Well, I mean, here's the thing, Dr. Mike, is one of the reasons why I really enjoy talking to you so much, and we often run into each other at conferences and that kind of thing, is it's really okay to have a difference of opinion, even if you're a parent seeing you in the practice and that you're going to share what you think works best, but you're also really open to what works best for each individual family.
Exactly.
And I feel the same way. And I work with a lot of different families from a lot of different socioeconomic backgrounds, but also a lot of different cultures, as you yourself have just mentioned. And so when we think about that, yeah, I agree. I would love to see parents, and I try to help them and get into their kitchens because I go into people's homes and teach them how to just make their own baby food. And how to use the foods that they're eating and present them safely, whether we're just going to shred some meat, smash up some beans, whatever it happens to be.
Yeah.
I also know there are definitely times where an inexpensive pouch or an inexpensive jar of baby food thrown in your diaper bag is a huge convenience, and there are many options out there that are really nutritious too. So I think what we're both saying is it's about balance, and it gets back to my original comment, which is there isn't one right way to do this. I want everybody to create the method that works best for them, but still following some of these non-negotiables. And I think another non-negotiable, unless there's a medical reason not to, that I think you'll agree with me about, is introducing the top 9 allergens early and often.
I think the medical consensus now is overwhelming that this has been the difference between America and the rest of the developed world when it comes to rates of food allergies, because it was staggering. And we're finally closing that gap because we have finally caught up to what the rest of the world seemed to do intuitively, which is that the child should be eating what everyone else in the family is eating and not be isolated from certain foods, and start that right away. And we're seeing that gap close. So yes, I think is one of the most clear consensus approaches, that allergens need to be a priority from the beginning.
Yeah. And if your followers aren't familiar with the top 9 allergens, I'll just list them super quick. Cow's milk, eggs, fish, shellfish, tree nuts, peanuts, wheat, soy, sesame. There you go. But I know how overwhelming it can feel to a new parent to start solids A and then have someone like me tell them, okay, now you got to focus on allergens. So on my website, and I'm happy to share the link with you.
Yeah, if you could send the link, because I give out your website all the time. But
I know, you're the best. Thank you. But for all of your listeners, I have all these free downloads that include a super convenient allergen chart that was designed with pediatricians, with an RDN, and they designed so that parents simply check off every time they've offered the allergen, and also gives them tips on how to do that. And that brings us back to your earlier comment about jarred baby food, for example. I would love it if they had some of their own puree readily available. But if they happen to be out and about, or they're visiting grandma in, I don't know, Nebraska or something, and they're thinking, oh my gosh, I need to make sure I offer some peanut this week, and I don't have any Bombas around, or I don't have any of the prepackaged snacks that are great for that. I'm going to grab 2 teaspoons of peanut butter. I'm going to mix in a little bit of that banana puree, or mash half of a banana if I happen to have one in the house. There we go. So, I love purees for that reason, because they make everything a little safer to offer.
Sure.
And we even can be on the go. Yeah. But we don't want to linger on any one food, which is what you're saying so beautifully, because to help develop those oral motor skills, that is so important to have a variety of safe textures and that early and consistent exposure to allergens. Last tip on that, because I just don't want to forget this, Dr. Mike, is for everybody listening, I know we're talking about starting solids, but don't stop in babyhood.
Yeah.
Keep offering these foods, these top 9 allergens through the toddler years. That's what the research seems to indicate. So I really hope that they'll take a look at those handouts, which will guide them even more than
Absolutely.
we can do.
Could you just quickly mention the website real fast for everybody?
I'd be happy to. My website is my munch bug, like munching, or melaniepotok.com. Melaniepotok.com.
Can you quickly say a few words about the Dr. Yum project? Because I know that's also
kidding?
a website.
You bet. Yeah. I am so thrilled to be a volunteer for the Dr. Yum project. The Dr. Yum project was created by my co-author of Raising a Healthy Happy Eater, Dr. Namali Fernando, a pediatrician in Virginia. Her patients call her Dr. Yum because she'll take them right into her teaching kitchen and show them how to make baby food, like you're talking about. Yeah. But what they do is they are on a mission to help all families thrive and raise healthy, happy little eaters. And we have several projects in the works, but for the sake of this podcast, I will say that on dryum.org, and it's spelled out DOCTORYUM.org, you'll find Dr. Yum's baby food toolkit, which is exactly what you're talking about. How we can make baby food right from whatever we're eating for lunch or dinner or breakfast or whatever it happens to be.
Amazing. I would like to segue this into the next major, I think, topic that inhabits our parental sphere. And I think that no parent is immune to this and really intersects with initiation of foods. And then what happens in toddlerhood is picky eating and how to navigate that in a healthy way as a parent, and what to know as far as normal, what to know is the best approach, and how as a parent we can lower our anxiety around this developmentally normal kind of picture without necessarily going overboard, having a rational, healthy approach to it instead of a reactive kind of like overly emotional, anxious approach to it, which is what happens to a lot of us when our toddlers reject food over and over, and then we worry they're going to starve to death overnight. So
yeah,
could we kind of segue into that idea about, and so maybe about how does anything in the process of initiation impact picky eating once they get into the toddler years, 1, and 2, because it inevitably happens across the board. What is a healthy approach, and when do parents need help with someone like you? So if we could start with that linear sort of discussion.
Yeah, definitely. All right. So I want everybody to understand that I'm a pediatric feeding therapist. So I work with children who have garden variety picky eating all the way up to more extreme picky eating. And I also help parents start solids. So coming from that standpoint, what I want to share with everyone is that 3 out of 4 typically developing kids will grow out of picky eating. 1 out of 4 will not, and they're going to need additional help. And I think what Dr. Mike's mentioning here is, okay, how do we know if that 1 out of 4 is my kid? And how do I make sure out of the other 3 that they don't turn into the one who gets even pickier? What do I do?
Is that something that I have any impact on in terms of through my parental approach?
You do. Okay. And to quickly answer about the 1 out of 4 and how to get help is you're going to ask your pediatrician for a pediatric feeding evaluation in your area. And they can guide you for the best resources for that. It varies from state to state, but oftentimes it's free. And we also have excellent people in private practice as well that can support you. But jumping back to the main gist of this, which is, well, is there anything I do as a parent that could frankly kind of make this worse, which is what we all worry about as parents? And the response that we have to our child's unwillingness to try a new food can really influence their future willingness to give it a try. And what that comes down to is a model of feeding that's my 3rd non-negotiable, which is responsive feeding. This one is so close to my heart. It is a model featured in my most recent book called Responsive Feeding, The Baby's Safe Guide to Stress-Free Weaning, Healthy Eating, and Mealtime Bonding. It's the only method endorsed by the American Academy of Pediatrics, the World Health Organization, and UNICEF. And whether you're following a BLW or a hybrid model or just starting with purees, you're still going to do it in a responsive manner. I have to say, I almost making it sound like I invented this approach, and I definitely didn't. It's been around since the 1990s. But I did have the privilege of writing the first comprehensive book for parents. So being a responsive feeder simply means paying attention to your baby's cues. So when they're hungry, when they need to pause, and when they're full. It's avoiding phrasing like, oh, just take one more bite for mommy. Or, you need to eat more. You've got soccer ahead. Or, you didn't eat a very big breakfast or lunch. I need you to eat at least 5 more green beans because you're 5 years old. Avoiding things like that, because instead, from the point of starting solids all the way through the school age years, we want kids to listen to their own body and decide whether they're full, whether they just need to take a break for a minute, as we all do, or whether they are still hungry. So,
and my caveat to that is, and I love that, but and I think that my caveat to that is that that is parents responding to their own anxieties or to their own concern about how other people are viewing it, and then feeling like, well, they have to see that I noticed this and I'm not letting my kids starve. It's
right.
all of those responses come out of our own issues and how we respond, and our concern for how it looks externally, or just because of the anxiety that was downloaded to us from our own parents about eating enough.
Which is understandable. My own parents worked during the Depression. I understand why they felt that way. But now, and we certainly want to be sensitive to many families who are struggling to find food and are battling food insecurity. And it's something that we have a whole chapter in one of my books about, because that's a reality. But the bottom line is, a parent's role is to provide nutritious foods at predictable times. We call those eating times. And between those eating times, we have growing times. Those are built-in breaks that let little ones rest and kind of reset. It's also really important for dental health that kids are not grazing all day. Water, of course, is always available throughout the day, but milk, no. Yeah, unless there's a medical reason for it. And that's one thing that I'm sure you run into too, where parents say, but I am offering food every few hours, but the kid is also grazing on milk all day.
So my point on milk is that milk is probably the most overused substance, especially in this age. Healthy children need very little and are fine with 0. And milk does 3 things when it's overused. And I'm sure you'll resonate with this. I'm just going to say it because I say it all the time. One is it actually blocks the absorption of other nutrients because of the over calcium soaking of your gut. It blocks iron intake. Your baby's body needs iron probably as much or more than almost any other single nutrient. 2, it fills them up and gives them empty calories, mostly in the form of sugar. It's a natural occurring sugar, but it's sugar, which suppresses their appetite and interest and hunger drive in other foods. And 3, at a certain level, even if you're not allergic to it, it doesn't matter. It's pro-inflammatory if you're overusing it. But
Exactly.
so those are my sort of brief points on why milk should not be, because parents feel better. Oh, my kid's not eating, but he drank enough milk today, so I feel okay. It's not the case.
And you know what? There's something really, I don't know, it's about love and nurturing, holding on to that baby and watching them drink that milk. There's something.
It just feeds that little primal thing in us all the time.
I love it. And also, full disclosure, my dad grew up on a dairy farm. We are the big dairy family, and I love milk. I'm not knocking milk. I'm agreeing with you in that, like any food,
anything substance, milk is a good example of that.
Milk is a good example, but you brought up some excellent points, which also, brings me to your next point, which was nutrition, which is another non-negotiable for me. So once your baby begins solids, there really are, as you've mentioned, 3 key nutrients that deserve extra attention. And those are iron, zinc, fat. We could add in a few more too, but those are the ones
Sure.
that we really pay attention to.
But I emphasize iron and zinc all the time.
Do, and I love that. I also want to point out that when you think about, listen to these words for a second: iron, vital for brain development, red blood cell production. You can offer it via smashed meats, beans, lentils, and iron fortified cereals. A little bit would be okay, right? I mean, my thought is it's a nice way to boost it up if you need to. Not I like a couple boxes of that. It's okay if you don't.
Yeah. True.
And but what did I just list? Top allergens. So by introducing those top allergens, you're also doing that weekly dose of allergy prevention. Likewise with zinc, important for growth, immune function, etc.
Appetite, honestly.
Appetite, yeah. And again, meat, lentils, yogurt, fortified grains, and all part of those top 9 allergens. Fat, thin nut butters are such a good source of that. Really important for growth and brain development. So,
can you comment briefly on the commercial products that parents are being sold? These 1 spoonful or allergen packages that they mix. I just don't see anything wrong with them. They all seem to be very rational. Do you have any position or recommendation around them?
Yeah, I don't have a problem with them at all, but I do want to consider that every family is unique. Their budget is unique, especially nowadays.
Yeah.
And there are times where it might be more economical to do it on your own. But on the other hand, as we mentioned earlier, to have something like that in the diaper bag as you're out and about and go, oh my gosh, here's some peanut puffs that I can offer. And now I just got him that dose of peanuts. I think it's wonderful that we have the option.
Yes. Great.
Great.
And then let's segue into kind of the last part about, when you have a toddler and you've been focused on these things, how do you as a parent know I need help? This is not typical or going the way it should. And listen, I'll be the first one to admit, in a pediatric office where all of us are kind of now forced into seeing 6 patients an hour because of things that are out of our control, we don't always have the ability to pick up on this in the way we should and spend the time on it. So how do parents need to know that they need to speak up and going, this is not going well and I need help?
They know to do that when they're stressed.
Got it. They should listen to their cues. If every meal is becoming this highly charged, over emotional, anxiety ridden experience, that is your first maybe cue that you are needing outside help.
Let me tell you something.
Yeah.
When I'm feeding my almost 2-year-old grandbaby, and he's over at my house a lot, I do this for a living. I've written 6 books on this. When he doesn't eat a good lunch, quote unquote, a good lunch, I don't know that I feel offended, but I have this moment of, I've got to tell his mom that he didn't eat.
I got to tell his mom, and then she's going to be like, what do you mean, Grandma? Why do you eat a good lunch?
And it is so tempting when he says, pouched right afterwards, to give him that pouch, because then he'll get something in his belly, or if he, signs for milk, his favorite beverage. And by the way, for Halloween, he was a dairy farmer. So I just want you to know his parents were cows. So I want everybody listening to know that, listen, I know this isn't easy. And there are days I'm giving him a pouch to reduce my own anxiety. But 90% of the time, please don't. 90% of the time, try to follow that growing and eating time schedule. Get them out of the kitchen, get them distracted. Toddlers sometimes barely eat it all in a day.
Right. So I know that you've heard me say this. And so I think first off, the takeaway about, if parents are going to know they need help, if they find themselves at every encounter around food is becoming hyper emotional and charged, then you know that that is your first sign that you need to speak up and ask for help. It's not going well and there are resources available. It doesn't have to be that way. And if you don't listen to that, you could be making it worse. And I always remind people that toddlers also, let's just, in terms of the normal developmental thing is, toddlers' appetites and food drive don't line up with adults, the adult version of that. So it is not unusual that your healthy toddler preschooler will join you where you can actually see them eat the meal and eat everything. That'll happen once or twice a week sometimes. And the rest of the week, you just won't see it. And that is okay if your child is healthy and growing and thriving in all these other ways. And your pediatrician can certainly help you, reassure you about that. And not letting that pattern create a negative emotional feedback loop that can then create more problems.
Which just gets back to following that responsive feeding model. And
responsive feeding, exactly.
Definitely responsive feeding. And what two things, I just want to piggyback on what you said to make sure it's really clear for everyone. The advantage of getting into feeding therapy early is that you will get tips that are designed specifically for your child, for you, for your family, and what works in your food culture.
Absolutely.
The longer we wait, the harder it is to change some of these patterns. And why go through all that stress? So to just piggyback on your comment, just stress that to your pediatrician that you're stressed. Even if you need to set up a separate time away from your child to talk to them over the phone and get this set up, or to talk to one of their support team, let's get this set up. Okay, what do we do in the meantime though? Well, that brings me to our fifth non-negotiable, and this is actually a really big one for me. We just focus on variety. Variety, variety, variety. If your kid only eats chicken nuggets, French fries, and applesauce pouches, naturally we're going to keep those in the rotation. But we're going to still focus on a teaspoon to a tablespoon of one or two other foods showing up on that plate just to make friends with them. That's all we're going to do. And you sometimes have to do that from 18 months to age 3. Never give up on variety. It always pays off.
But doing it in a way that isn't coercive or based on compliance or outcome.
Correct.
Okay.
It just is on our plate like parsley. It's there to look pretty. It's there to make friends with the other food. It's there to smash with your fork if you want to. It's up to the kids how they want to interact with it. But the earlier you start, and you're going to start with starting solids and putting those small samples, so it's not wasting food, on their plate on a regular basis, every single meal, a variety of different foods, you will be surprised what a difference that makes as time goes on.
Amazing.
It's essential. It really is. So don't let it be so overwhelming. Reach out for help, of course. And when you really focus on safety, early allergen introduction, responsive feeding, solid nutrition, and variety, you'll create a foundation for positive, lifelong relationships with food.
I love it. I think that that's a great place to leave off. And I would invite everybody to follow Melanie's content on Melanie. Quickly, I want you to list off, so at the end, everyone has your website, the Dr. Yum Project, and where to follow you content on social media.
Thank you. Yeah. The Dr. Yum Project is my volunteer work with the wonderful Dr. Yum and her team. My website is Melanie Potok, or mymunchbug.com. And the best place to follow me is on Instagram, and it's mymunchbug_Melanie Potok.
Fabulous. Fabulous. And I look forward to continuing to learn more from you and using this to help my parents and families in my practice. I'm literally the poster child for our primary care practice, and really just can't wait to share this with more families. And I think that this is the kind of content that parents need to dial down their anxieties, make them feel they have a toolbox, they have an approach. And when parents, I think, feel that, they feel less adrift. And I think it really does help manage the anxiety and make them feel more comfortable and confident, and that they're not just sort of, responding to their own sort of worries and anxieties around food and eating. So thank you again for joining us, Melanie. I'm really grateful for your time and looking forward to hearing more from you. And so once again, you guys can find Your Kids Will Be Fine's available on every platform, Apple, Spotify. And don't forget to go to our website, yourkidswillbefine.com. You can download entire show episodes as well as leave comments and show suggestions. Thanks for joining.
Thank you. Bye-bye.